name is Whitney. I'm a registered nurse. Welcome back to my channel. Today I'm going to be talking about report. Stay tuned. So first thing is to create your own report sheet. I created mine some time ago after trying it for a couple of them. So I started with one and I tried it for a week. I see how I liked it, how I can improve on it, and then after improvement, I tried another one for a week, and so forth. Eventually, I came up with this. I like all my patients lined up, depending how many patients I get for the day. I have all of them, one paper. I can see. So when you first get there, try to get there a little early. Try to see the patient if it's COVID. I know it's kind of hard, but try to see the patient first. Try to see if they have Foleys. Try to see if they're up and they can talk, what they can do, if they have any drips running, if they have any feedings. Just kind of assess the room real quick before getting a report. Reports should last about less than 5 minutes. You should get in, get out, try to get all the information you need for your patient in case of emergency prior, and then you can look everything up by yourself. So when you come in, you need to know if this patient's full code. You need to know what they're allergic to. You need to know exactly a little bit of a history, what they can do if they're dialysis patients, what you can push, what you can give them. So coming in, you get off course, you get ready, you go see your patient prior, and start getting report from that nurse, either night shift or morning shift. You start with their name, room number, admission date, just for placement purposes. You think of that, they're going to be going home, where they come from. Their age is essential as well, just if you're doing peds, etc., or babies, and what they're allergic to. You go from there, and their primary diagnosis. Then you kind of know the diagnosis, why the doctor, what the reason the doctor thinks. And some of them will be there for months, and their diagnosis doesn't even apply to them anymore, but it's based on care. You kind of figure it out as you go. Know a little bit of history if they're diabetic, the hypertension, for you to have an idea what medications they're going to be taking, what they should be taking, and we'll go from there if they're diabetics, etc. Based on that, you need to know who the doctor is, if they're on precaution, droplet. You need to know what gear for you to protect yourself as well. You need to know their neuro status real quick to know if they're on restraints, not restraints, combative, because that can take a lot of your time and day if they have anything for that as well. Cardiac wise, you need to know what they are on tele, what their vital signs are, what their labs, if they're taking anything from DPT. Also respiration, if they are on oxygen or on room air or on a mask, breaks, etc. And what their O2 sat, or what is the liters that they're on. For DIGU purposes, you need to know what they can eat, what they have. Some patients are on a soft diet, or some people are NPO going for procedures. Very important for you to know. If they're Accu-Checks, diabetics, if they're on any feedings, if they're able to produce bowel movements, if they have a colostomy bag, if they're dialysis, if they're producing any urine, if they have a Foley, if they're continent, incontinent. That can be very important for you to coordinate with your PCA and other members of the team. Think about wounds if they're incontinent, so you might want to consult with the wound care nurse. You think of the skin, because skin is very important, especially for diabetics or any kind of patients that are not moving and they're staying on their bum for a long time. So think of sacral wound, you think of heel wounds, you think of elbows, anywhere there's bony prominence, and that can be very dangerous for the patient. Characteristics, if they're drug seeking, the nurse thinks they're drug seeking, hiding drugs, if they came from a procedure and they're going to be in pain, what medications they have, what is just so general. You don't have to drill the nurse, just be like, all right, did I have anything for pain? Okay, look. Lines, very important, especially during an emergency. I need to know if the patient has an IV, a PICC line, how many things I can run at once, if they're hypotensive, if I'm going to be pushing anything, if it's double lumen, if they have a CVC. Lines are very important in case of an emergency, because I'm going to be pushing and I don't have time to be starting an IV. Next is their muscular, essentially. What are their functionalities? Can they walk? Can they talk? Can they move around? Can they eat by themselves? What can they do? Do you use a walker? Do you use a wheelchair? Are they gonna be a safety issue? Are they gonna try to get up and fall? If I need to put bed alarm on. So those things that you think about. Patients are going for procedures, you need to know if they have the chlorhexidine map done, if the consents are signed, if you have to call the family for the consent, or if they are alert and oriented. And of course, they will be signing their consent. If they have any questions, they just call them. So you have to advocate for your patients. Also, you need to know the treatment plan for this patient. Is this patient going home? What is the plan? Is the family going to pick them up? Are they going to a sniff? Are they going to a rehab? What's going to be done? Because they can't be in the hospital forever. Thank you so much for watching. Again, my name is Whitney. Don't forget to subscribe, press the like button and the bell button for you to be notified every time I post something. I'm going to try to post more and more. You can follow me on Instagram, WPierre21. It's also for the same for my Snapchat, my TikTok, my Twitter, WPierre21. I hope to see you back soon. Thank you so much for watching. Bye.